right, guys, let's go over how Medicare works, the basics of it. What we're going to talk about is Medicare eligibility, enrollment, and what your options are, okay? So Medicare is a federal health program primarily for individuals 65 and over, but also for disabled folks on Medicare under 65. So let's talk about Medicare eligibility. General age requirement, you got to be 65. When you turn 65, you go on Medicare. Who has to enroll at 65? Individuals who are no longer working or whose spouse is no longer working and don't have employer-provided insurance, or COBRA, those on COBRA insurance, which is just an extension of employer-provided insurance for former employees. Retired military personnel with TRICARE. When you turn 65, that transitions into TRICARE for life at age 65. Individuals on Obamacare, the Affordable Care Act, that becomes less beneficial after 65 due to the loss of subsidies and cost sharing, so you got to go on Medicare. Now, employees working for small companies with fewer than 20 employees should definitely enroll in Medicare at 65. If over 20 employees, you may want to do an analysis and take a look if you really need your Part B. So delayed enrollment, that can cause penalties. If you're still working for an employer with 20 or more employees and have employer-provided insurance, you can delay Medicare without penalties, all right? And just remember automatic enrollment. If you're already receiving Social Security benefits when you turn 65, you're automatically going to enroll in Part A and Part B. If not, you'll need to initiate. You'll need to self-enroll using myssa.gov during your initial enrollment period, okay? That's your IEP. So there are Medicare enrollment periods. The initial enrollment period, you got 3 months before the month you turn 65 or enroll in Part B, the month of your 65th birthday or that you get your Part B, and 3 months after. Now, there is something called general enrollment. If you miss your initial enrollment, you can enroll between January 1st and March 31st each year, and that coverage will begin the first of the next month. Now, what are your options? Real simple. Let's go over the parts of Medicare real quick. Part A is your hospital, skilled care, and hospice. Part B is everything outside the hospital, your outpatient care, doctor, blood work, preventive services. Now, what you could do is get a Medicare Advantage plan. I wouldn't recommend that. You're not really on Medicare, or you trade in your Medicare and you allow a private insurance company with stockholders to manage your care through restrictive networks, denials, prior authorizations. You could just stick with Medicare and get a Part D drug plan. That would be, you could purchase that separately, or you could get a Medicare Advantage plan. Again, if you don't want just Medicare with a drug plan because you got to pay 20% of all your Part B bills, all right? Now, what I strongly recommend, and all of us at May River Medicare, we recommend you get a Medigap or Medicare supplement insurance that covers all the gaps in your Medicare, your original or what we call traditional Medicare. So what are your options? Option one, Medicare A and B only. Probably not the best option. This is basic Medicare coverage. This option leaves huge gaps. 3 gaps in Part A, 3 gaps in Part B, and you don't have any prescription drug coverage. You could always use GoodRx or go through Canada, but I wouldn't recommend that. So option 2, you keep your Medicare A and B, and you get a supplement that fills in those gaps that traditional Medicare doesn't cover, like your Part A deductible, your Part B co-insurance of 20%. This option involves a separate supplemental plan. For people turning 65, you're either going to go into Plan N or the Plan G. Very similar plans. These Plan N and Plan G, they're going to cover the gaps that Medicare A and B does not cover. Like I said, co-pays, co-insurance, deductibles. Popular Medigap plans include the Plan G, which covers everything except the $257 annual deductible. Plan N, virtually the same as Plan G, covers all the gaps. But you do have, just like the Plan G, you got a deductible, an annual $257 deductible, but you also have a $0 to $20 doctor copay, and you got a $50 emergency room copay. So option 3, you could get Medicare Advantage. They call that Part C. These are private insurance companies that replace the benefits of Medicare Part A and Part B. They come with additional perks like silver sneakers, dental, and vision. With an Advantage plan, you'll pay co-pays and co-insurance for everything. But unlike original Medicare, there's a max out-of-pocket. Medicare set the max out-of-pocket $9,350 in-network, out-of-network $14,000. Some considerations you got to take into place when you're choosing coverage If you prefer a simplified all-in-one plan, Medicare Advantage may be right for you. Medicare Advantage is the only folks I sell Medicare Advantage plans to are 65 folks that are under 65 on disability, or low-income folks get Medicare and Medicaid, or perhaps they have extra help for their prescriptions. Either you really, when you're doing a Medicare Advantage plan, you got to look to make sure your doctors are in the network, your drugs are on the formulary. You want to look at the reputation of the company. All these companies are going to deny anything expensive with a Medicare Advantage, skilled care, surgeries, things of that nature, cancer that you could risk delaying your cancer treatments, because again, these are private insurance companies with stockholders that they behold to. All right. So if you want to stay with original Medicare, you want to definitely get a Medicare supplement and a Part D drug plan to cover all your healthcare needs. Your choice will reflect your healthcare needs, your budget, whether you want the flexibility in being able to go to the Mayo Clinic or MD Anderson for cancer. You just really need to consider all the factors. If you're okay with a restrictive network and you use only local doctors, an Advantage plan might be an option. Again, we are financially incentivized to sell you Medicare Advantage plans. Just as an example, when somebody turns 65, an agent gets $611 commission, then they get a $304 renewal every year that you're on a Medicare Advantage plan. Medicare supplement, my average Medicare supplement commission is about $240 when someone turns 65, and we get that as a renewal. So we are hugely financially incentivized to go with the Advantage plan. Find an agent that has your interests, not their interests, their best interests in mind. Consult with a Medicare advisor to help you make the best choice based on your particular situation. And give us a call at 843-227-6725.